Today we have the privilege of having Dr. Puneet Rana Arora, a leading obstetrician and gynecologist practicing in Delhi NCR. She specializes in IVF and infertility. Welcome, ma'am.
Thank you.
So first question, ma'am, how long is the IVF process from start to finish?
First of all, thank you very much for having me here. So answering the first question, so the IVF process generally can be completed in 21 days or it can be split over 2 months. Why this happens is it is dependent on patient to patient characteristics, because an IVF process involves egg stimulation, it involves retrieving those eggs outside the human body, it involves fertilizing those eggs with the sperm, generating embryos, and then the last process is putting these embryos back into women's uterus. So sometimes the last procedure, which we call as embryo transfer, can happen over the next months, and that's why we say it can complete in either 18-21 days or can be split over 2 months.
Thanks. So is IVF painful?
I won't say it is painful. It does need commitment because it involves series of steps for which both men and women have to be committed, and hence that's why if they are committed we get good results. It involves daily injections for a woman and they are generally time bound, so they have to be given on time. It involves taking eggs out under anesthesia, for which if she's working she has to take a day off from her work, and then it involves putting those embryos back. So that's why it just needs commitment, but I wouldn't say it is painful.
So the next question is a bit more detailed. Where are eggs, sperms and embryos stored?
Right. So we have a separate dedicated room for that according to new ART law which came in 2021. And we have been always doing that, but after the law, it has become very stringent to store them in separate rooms. We store them in containers called as cryocans. Now these cryocans contain liquid nitrogen, which have a temperature minus 220, minus 210. And we freeze the eggs and embryos in straws, and these straws are then placed in liquid nitrogen, and they are preserved there in a very, very secure and confidential way.
The next question is essentially what most of the people generally wants to know is, what is the success rate of IVF?
Yes, and I think very rightly said. All of our patients, when they walk to this clinic, they do ask, what is your success rate, doctor, or what is the success rate of the clinic? Again, the answer to this question is that it is very much individualized. It depends on what they come to us with, because what history they have, why they have not been able to achieve pregnancy so far, whether it is a tubal factor, whether it is egg problem, whether it is sperm problem or uterus problem. So the success rates varies from person, couple to couple. Generally, we say the success of a cycle, IVF cycle, can vary between 30% to 70%. But again, like I said, a lot of factors, contributory factors have to be kept into consideration for this.
The next question essentially is one of the top 3 questions in our poll that has been asked by general public is, can anyone do IVF treatment?
Yes, if we take the general kind of audit of couples walking to our clinic, we would say that it has become common now, the uptake of IVF. It is no longer considered as a stigma undergoing a IVF treatment. But again, there should be an indication. Like I said in my previous question, I think it's important to know why the couple hasn't been able to achieve pregnancy. If there is a genuine indication for it, yes, IVF is very much applicable for them. But a lot of patients come to us who don't have necessarily very complex issues. They can achieve treatment with simple measures, infertility treatments like what we called as ovulation induction, IUI. They may not necessarily need IVF.
As a preparation for an IVF treatment, so is there any particular test that needs to be done before the IVF treatment starts?
Yes, and that's a very, very important question, because when we talk about success rate of 70%, which is a kind of a high success rate, it is very important that a couple is thoroughly assessed before they start their treatment, which includes blood test and also preparing them mentally and physically. With regards to that, I would say yoga and meditation does play a role. But if we talk about blood tests specifically, there are kind of an array of tests we do in a women and men, which includes their egg reserve assessment, the semen assessment, the thyroid profile check, their infection screening. So there are a lot of tests which we do. So it is good they come and meet a doctor and discuss about this test. They should not start straight away with IVF. They should undergo these tests beforehand.
So doctor, one major question is from the male population essentially. What are the issues or problems that a male partner has or that may affect the
pregnancy? So when we define various causes of infertility, male contributes around 25% of cases of infertility. So they do have problems which can affect a couple's chance of achieving a pregnancy. Now these various problems can be either, we generally assess them through the semen analysis, what we called as, it's an investigation, it's a test which is done. We look at parameters like what is the number of sperms in the ejaculate, what is the motility of the sperm, what is the morphology of the sperm. So there are various factors we see. Generally what we see is there's a problem in either of them. Either the number is not good, either the motility is not good, or the morphology is not good. So there are various treatment options we recommend them when they come to us to help them achieve a pregnancy.
Right, thank you. And that leads to the very obvious question is, what are the female issues or parameters that needs to be dealt with?
Yeah. That's I think important, because most of the couples when come to us, they want to know what problem I have. And I think if we tell them beforehand, these are the issues, it's easy to kind of guide their treatment journey. So when we spoke about male component, I did mention it's responsible for 25% of our infertility cases. Generally 50% our responsibility lies with the female in infertility, and there is a 25% subgroup where there is no reason, what we called as unexplained infertility. But if we look at infertility for females, generally there can be problems in the fallopian tubes, there can be problem in the uterus, or there can be problem in the egg number. Like males have sperm, females have eggs. So these three are the main reasons which can contribute to female as a contributory factor for infertility.
Now, CIFAR has been one of the leading centers for IVF treatment and offering excellent service to patients for years now. So the question is, what other services and treatments that CIFAR provides apart from IVF?
Yeah. So CIFAR is like a tertiary care provider of infertility. Over here, not only IVF is offered, but we offer basic treatments like monitoring the patient, finding out the reason why they are not being able to achieve pregnancy, offering them simple treatments with medications, with ovulation induction, where we just give them medications for stimulating their eggs and they try naturally. We do also offer them IUI, which is intrauterine inseminations, and then obviously IVF is there. But we also know that the limitation of IVF is it is not 100% treatment. So sometimes couples don't get pregnant even after getting a cycle of IVF. So we do see a lot of patients who had recurrent IVF failures. So we have advanced technologies to study their failure, that why they are not getting pregnant. Like we do have tests for receptivity of the endometrium, we offer hysteroscopies, we offer the genetics on the embryo. So all these are offered so that the couples take happiness in the end.
The last question is essentially, what's the journey of a patient who comes in for IVF treatment?
So I feel I have a very strong belief in that medical treatment has to be combined with a psychological support, especially in patients with infertility. And we at CIFAR do make sure that we not only offer the best of medical treatment, but we also handhold the journey of our couples psychologically, making them mentally strong to undergo the treatment of infertility. Because there was a question that is it painful? And like I said, it's a commitment. They may have to take time off from their work. So it can put mental stress on the couples on top of they're not achieving a pregnancy. So the treatment is very much holistic here, combining the medical and the psychological support here. So when they come here, they are looked after by doctors, they are looked after by counselors, they are looked after by embryologists. So they kind of, like I said, it's a holistic journey in CIFAR for having an infertility treatment.
Thank you, ma'am.